The sunshine vitamin. What is vitamin D? Vitamin D is a unique nutrient. It's not exactly a vitamin but rather a prohormone. This means your body can produce it when your skin is exposed to sunlight. Vitamin D plays a crucial role in many bodily functions, making it essential for overall health and well-being. One of its primary functions is regulating calcium and phosphorus levels. These minerals are vital for strong bones, teeth, and muscle function. Vitamin D also supports the immune system, helping your body fight off infections and diseases. Beyond its role in bone health and immunity, research suggests that vitamin D may offer a wide range of additional benefits. These include reducing the risk of certain cancers, improving heart health, and even playing a role in mood regulation. Ensuring adequate vitamin D levels is essential throughout life, from childhood to adulthood and into our senior years. Understanding the importance of this sunshine vitamin can empower you to make informed decisions about your health. Strong bones and beyond. The benefits of vitamin D. Vitamin D is best known for its role in building and maintaining strong bones. It helps your body absorb calcium, a crucial mineral for bone density and strength. This is especially important during childhood and adolescence when bones are still developing. However, the benefits of vitamin D extend far beyond bone health. Studies have linked adequate vitamin D levels to a reduced risk of various chronic diseases. These include heart disease, type 2 diabetes, multiple sclerosis, and some types of cancer. Vitamin D also plays a vital role in supporting immune function. It helps regulate immune cells, ensuring they function properly to fight off infections and diseases. Maintaining optimal vitamin D levels may help reduce the risk of colds, flu, and other infections. Furthermore, emerging research suggests a link between vitamin D and mood regulation. Some studies indicate that vitamin D deficiency may be associated with an increased risk of depression and mood disorders. While more research is needed, these findings highlight the potential impact of vitamin D on mental well-being. Soaking up the sun. Natural sources of vitamin D. The most natural and efficient way to obtain vitamin D is through sunlight exposure. When your skin is exposed to the sun's ultraviolet B, UVB rays, it triggers vitamin D production. However, the amount of sunlight needed varies depending on several factors. Your skin type, the time of day, season, and geographical location all play a role in vitamin D production. Generally, 10 to 15 minutes of sun exposure to your face, arms, and hands without sunscreen between 10 a.m. and 3 p.m. is sufficient for most people to produce adequate vitamin D. However, it's essential to be mindful of excessive sun exposure. Too much sun can increase the risk of skin cancer. If you're spending prolonged periods outdoors, especially during peak sun hours, it's crucial to protect your skin with sunscreen, protective clothing, and seek shade when needed. Remember, even on cloudy days, your skin can still synthesize vitamin D from sunlight, although at a reduced rate. Therefore, spending time outdoors, even for short periods, can contribute to your overall vitamin D levels. Food for thought. Dietary sources of vitamin D. While sunlight is the most efficient source of vitamin D, certain foods naturally contain this essential nutrient. Incorporating these foods into your diet can help supplement your vitamin D intake. Fatty fish, such as salmon, tuna, and mackerel, are among the best dietary sources of vitamin D. Egg yolks also contain vitamin D, although in smaller amounts. Additionally, some mushrooms exposed to UV light during growth are good sources of vitamin D. Many foods are fortified with vitamin D, including milk, yogurt, orange juice, and some breakfast cereals. These fortified foods can be convenient ways to increase your vitamin D intake, especially if you have limited sun exposure or dietary restrictions. When choosing fortified foods, check the nutrition labels to determine the amount of vitamin D per serving. This information can help you make informed decisions about incorporating these foods into your diet to meet your daily vitamin D requirements. Section 5. How much is enough? Recommended daily intake of vitamin D. The recommended daily intake of vitamin D varies depending on age, health status, and individual needs. The National Academies of Sciences, Engineering, and Medicine has established recommended dietary allowances, or RDAs, for vitamin D. For infants up to 12 months old, the RDA is 400 IU, or international units, per day. For children and adults aged 1 to 70 years, the RDA is 600 IU per day. Older adults aged 71 years and above have an increased RDA of 800 IU per day. These recommendations are for generally healthy individuals. However, certain factors, such as having darker skin, being obese, or having malabsorption disorders, may increase your vitamin D requirements. Pregnant and breastfeeding women may also need higher amounts. It's essential to consult with your healthcare provider to determine your individual vitamin D needs. They can assess your risk factors, order blood tests to measure your vitamin D levels, and recommend appropriate supplementation if necessary. Section 6. The dark side of deficiency, vitamin D deficiency risks. Vitamin D deficiency is a common health concern worldwide, affecting an estimated 1 billion people. It occurs when your body doesn't have enough vitamin D to function properly. In children, vitamin D deficiency can lead to rickets, a condition that causes soft and weak bones, leading to skeletal deformities. In adults, vitamin D deficiency can result in osteomalacia, a softening of the bones, which can increase the risk of fractures. Beyond bone health, vitamin D deficiency has been linked to an increased risk of various health problems. These include cardiovascular disease, type 2 diabetes, autoimmune diseases, infections, and certain types of cancer. Symptoms of vitamin D deficiency can be subtle and easily overlooked. They may include fatigue, muscle weakness, bone pain, depression, and hair loss. If you suspect you may have a vitamin D deficiency, it's crucial to consult with your healthcare provider for proper diagnosis and treatment. Section 7. Too much of a good thing, vitamin D overdose. While essential for health, it is possible to have too much vitamin D. Vitamin D toxicity, also known as hypervitaminosis D, occurs when vitamin D levels in the blood become excessively high. This condition is rare and usually caused by taking high doses of vitamin D supplements over a prolonged period. Symptoms of vitamin D toxicity can include nausea, vomiting, constipation, weakness, confusion, and loss of appetite. Excessive vitamin D can lead to a buildup of calcium in the blood, known as hypercalcemia. This can cause a range of health problems including kidney stones, kidney damage, and heart rhythm abnormalities. It's crucial to follow the recommended daily intake guidelines for vitamin D and avoid taking high doses of supplements without medical supervision. If you experience any unusual symptoms while taking vitamin D supplements, discontinue use and consult with your healthcare provider immediately. Section 8. Finding your balance. Testing and maintaining optimal levels. Maintaining optimal vitamin D levels is crucial for overall health and well-being. Regular testing can help determine if you're getting enough vitamin D or if you require supplementation. A simple blood test called a 25-hydroxyvitamin D test can measure the amount of vitamin D in your blood. This test is widely available and can provide valuable insights into your vitamin D status. If your blood tests reveal a deficiency, your healthcare provider may recommend vitamin D supplements to help raise your levels. Supplements are available in two forms: vitamin D2, known as ergocalciferol, and vitamin D3, known as cholecalciferol. In addition to supplementation, ensure you're getting adequate sun exposure and incorporating vitamin D-rich foods into your diet. By following these recommendations, you can help maintain optimal vitamin D levels for optimal health. Section 9. A final word on the sunshine nutrient. Vitamin D, the sunshine nutrient, plays a vital role in numerous bodily functions, from bone health and immune function to mood regulation and chronic disease prevention. Maintaining optimal vitamin D levels is crucial for overall health and well-being throughout life. While sunlight is the most efficient source of vitamin D, incorporating vitamin D-rich foods into your diet and considering supplementation when necessary can help ensure you're meeting your daily requirements. Regular testing can help monitor your vitamin D levels and guide appropriate interventions. By prioritizing vitamin D and making informed decisions about your health, you can reap the numerous benefits this essential nutrient offers.